Did you know that if your legs tingle or your memory fades or you have mood shifts and no one has any answers, including your doctor, well, it could be a vitamin B12 deficiency. And the scary part is that even standard blood tests might miss it. I am Dr. William Hunter, a family physician with over 20 years of experience, and in this video I'm going to show you the 5 strange symptoms and also a 3-step process to identify and fix B12 deficiency. And we'll do this without unnecessary medications by using the correct tests as well as smart supplementation, but also natural food-based strategies that actually work. You see, B12 is essential for your nerves, your memory, as well as mood regulation. But most people have no idea how easy it is to actually become deficient and how strange the symptoms can actually be. Why is that? Well, B12 relies on strong stomach acid to absorb, and often as we age, the acid declines. And if you've recently taken acid blockers, antibiotics, or you follow a vegan or vegetarian diet, well, you might be at risk. And here's the catch. Your basic B12 blood tests may look normal even though your brain is starving it. So how do you know if your symptoms are due to a low B12? Well, let's dive into the most overlooked signs, and then I'll give you the 3 steps to actually fix it. Now, sign number 1 is mood swings and depression. You see, low B12 raises a brain toxin called methylmalonic acid. It damages neurons and it causes low mood, irritability, and even dementia-like forgetfulness. And doctors may call it aging or anxiety, but it's often just missing B12 deficiency. All right, so sign 2 is numbness, burning and tingling in the legs. The nerve damage is usually in both feet. It's symmetrical and it slowly moves upwards. And some people describe it as pins and needles, others as cold feet even in the summer. And if left untreated, it can become permanent. Sign number 3 is memory fog or sudden forgetfulness. It might look like early dementia, but in many cases, correcting B12 actually restores clarity fast. In fact, one study recently showed that cognitive improvement within 3 months occurs on restoring levels. Sign number 4 is shuffling or stiff walk. Some people develop a slow Parkinson's-like gait. They drag their feet without even realizing it. Again, this is nerve damage and it can improve if caught early. Sign number 5 is tongue pain and cracks at the corners of the mouth. B12 deficiency can cause glossitis, swollen red smooth tongue, often with burning, or cracked irritated corners of the lips that do not heal. If you've had any of these mouth symptoms, you may be lacking B12. Now, here's the 3-step process to fix B12 deficiency naturally and also how to identify it correctly. Step 1 is get the right tests. You need to ask your doctor for methylmalonic acid and homocysteine blood tests, not just the total B12. They are more sensitive at detecting B12 deficiency. So if your homocysteine is above 10 or your methylmalonic acid is elevated, your brain and nerves are in trouble, even if your vitamin B12 looks okay. Step number 2, choose the correct form of B12 or eat more of it. The best supplement forms are methylcobalamin or adenosylcobalamin. Avoid cyanocobalamin. It's cheap and it's harder for the body to use. Start with 1,000 to 2,000 micrograms daily. Take it under the tongue for better absorption, and don't forget the correct foods. B12 is found naturally in grass-fed beef, wild-caught salmon, sardines, eggs, as well as dairy. And if you are vegetarian, fortified natural yeast can help, but supplementation is often needed. Step number 3, fix your gut to absorb the B12 naturally. You need healthy stomach acid and gut lining to absorb B12. So cut down on any acid blockers, avoid excess alcohol, and add fermented foods like plain yogurt, sauerkraut, or kefir. And consider a digestive enzyme if you're having reflux or bloating. These steps will support absorption and will help keep your B12 levels steady for life. So just to recap, if you've been struggling with unexplained or strange symptoms like tingling of legs or low mood, forgetfulness, or weird mouth pain, don't just let it go unchecked. Ask for the right tests. take the correct form of B12 that supports your body, and hopefully that will sort everything out. I'm Dr. Hunter, and if you found this useful, you can also check out another video I have regarding memory and regeneration of brain cells, and consider subscribing if you enjoy the content. And with that, have a wonderful day.